Okay, anterior knee pain or patella femoral pain syndrome or chondromalacia patella, which just stands for softening of the cartilage on the back side of your kneecap, which can cause pain. So most of the time, anterior knee pain or front knee pain, it occurs right like a ring, like a U almost, under on the bottom of your kneecap, on the side of it, underneath it, and on the inside of your knee. Sometimes it's more prominent on the inside here. Oftentimes, so old school mentality was that if we look at if this represents your thigh bone and this represents your kneecap, old school mentality is that there was maltracking of your kneecap or your patella on the femur, and the treatment for that was to get stronger quads, which is still good, but often prescribed was to strengthen up what's called the VMO, or your vastus medialis obliquus. It's a portion of the quadricep muscle on the inside. So oftentimes it was thought that the patella was moving laterally and that we just need to get a stronger pull of the muscles on the inside of the quad to pull you back that way. That's old school mentality. And if you see somebody that says strengthen up the VMO, find a new provider because they're old school, and that's not the way to go. Strengthen up the quad will help, but we can't really selectively train the VMO from what I have read thus far. Now, New Age studies by Christopher Powers back in 2003, I think, was they looked at somebody in a dynamic MRI and actually had them squat. And what they found was they didn't see the patella moving awkwardly on the femur, your kneecap, on the thigh bone. What they saw is that the femur was moving awkwardly underneath your kneecap. And this was actually coming from weakness of the muscles of the hip up here. So if we strengthen up these muscles at the hip, it's going to cause this to stop, and the tracking will be completely fine. And so 9 times out of 10, those are the kinds of things that when you have knee pain, you need to look to the hip, strengthen up the hip, get good neuromuscular control, reteach people how to squat the right way, and that'll take care of it. Sometimes people need orthotics to keep their arches up, but that's anterior knee pain.